Dr. Frita, can you give us some information? So what's the biggest, I guess, question that you have received from your patients about the vaccination, or some reservations that you've received from your patients?
I have gotten so many questions, Nikisha, and so many reservations from patients and people I've run into. But I would say that probably the most common one, and the one that just kind of makes good logical sense, is patients will ask me, how can you be sure that the vaccine won't cause me a problem? You don't know what's going to happen in 5 years, 10 years. How do you know that the vaccination won't be bad? How do you know? And truth be told, of all of the credentials we have, not one of us has a crystal ball as a part of the credentials. And so that's when I really have to stop and just be honest, but then break it down and go with the science. This vaccination is new. We don't know what it's going to do in 10 years and 20 years and 30 years. But here's what we do know. We know that the COVID-19 disease has caused an unprecedented damage to our lives, our population, the way that we live, the way that we see our families, the way that we interact, the way that we make money, the way that we thrive. We know that. We see the lives lost with the COVID-19 disease. We see the devastation, that we know. And as physicians, I'm sure we've all now seen some of the long-term effects that are happening from the COVID-19 disease. We're seeing blood clots. We're seeing some immune issues, even Guillain-Barré, a neurological disorder. We've seen, as a nephrologist, I've seen kidney failure associated with COVID-19. We're thinking that there is brain fog, confusion. We've seen patients have strokes. We've seen all of this devastation, and most certainly respiratory failure and death alone in the hospital without loved ones. This is what we know. This is not an unknown. We don't have to guess or wonder what COVID-19, the disease, will do. So now the vaccine. How do we know that it is safe? What we know is based on the studies we've done and the amount of participants we had in these trials, unprecedented. Normally when you have a trial, it can take months and months and years to get people to agree to sign up, to get the funding, to get it approved by the research board. But because the pandemic was such an emergency, we had all of these things happen so quickly. And so we got a chance to really get robust, excellent data with a lot of participants in a short amount of time. And so these vaccines have been studied really more intensely than any other vaccines in history. And we're being very careful as far as our safety and monitoring boards. And so we're looking at deaths and all of these things. I mentioned that we already had over 100,000 people in the trials, and now look at the tens of millions of people all around the world who have gotten the vaccinations. Thus far, they are safe. And so the answer that I give to that question is no, I do not have a crystal ball. I can only go on the studies and what we have thus far. And even though, yes, this is a novel coronavirus, and this very specific set of vaccines are new, vaccines are not new. This technology has been worked on actually for decades, if you go back. And so if you think about, being in school and going to work and having different vaccination requirements, we've been getting vaccinations all along. We've had herd immunity from different things like polio, like the measles. And so things are not quite as new and as warp speed as they may seem. So bottom line, if you say that you have a fear of the vaccine, I'll tell you that you should really have a fear of COVID-19. Trust the science, read the science, look for yourself. And which one do you want to face? The uncertainty, the unlikely uncertainty of what the vaccination may do, or the very definite devastation that you know and have seen that the COVID-19 infection will do.
Bam, and there it is, right there. Right.
And I want to just make a quick comment because I love the point that you just made up. It's not just because people in the Black communities are hesitant or wary, because that narrative has been put out there. And yes, there has been some challenge to vaccine acceptance, but that is not the reason why the Black community is not getting the vaccinations. For example, there are lots of cases where the administration has tried to do the right thing. They've set up places to get vaccination sites right there in these Black communities and underserved communities. But if you look at the people who are in the line, it's a bunch of privileged people from other neighborhoods, from white neighborhoods, who had been going in these Black neighborhoods that they likely had never been in, and getting vaccines that were actually meant to try to overcome that disparity, that gap. And so it's not even just about putting the vaccines in the underserved communities, it's about protecting the vaccines to make sure that they get in the arms of the underserved people. And so I know that in some places, they are now actually doing some grassroots movements where they only let the people know in certain zip codes, underserved zip codes, when the vaccines are coming. Or there have been government mandates saying you have to live in these specific zip codes where we're taking the vaccines. That way you don't get people coming from all of these lofty, rich neighborhoods going into the Black neighborhoods, defeating the purpose. And so I agree, we definitely have work to be done. But as the problems pop up, it looks like the current administration is trying to push them down. But this is just such a dynamic process that I agree, we're not going to know for sure the exact date. And so that's a tricky question to answer.
Thank you for that. Just like that, time is up. This is a topic that we can go on and on about because things are changing daily and we are learning new things every day. I cannot express enough our gratitude to our 4 doctors for sharing your expertise with us. Our hope is that you've learned something you did not know before and that you are empowered to share your knowledge that you have gained here with your community. We had no idea a year ago that we would be where we are today. Let us do our part to slow and end the spread of this virus. Remember, wash your hands, wear your mask or 2, socially distance, and make smart choices. I would like to pass the virtual mic to Leroy Carson.